It is April Fool's Day, and we don't want you to be fooled by some common misconceptions about your health. So with us today is Dr. Patrick Wright with Cone Health Community and Health and Wellness Center. He's going to debunk some common health myths, and he's going to set the record straight. Okay, let's start with myth number one, Dr. Wright. And myth number one is food package labels that say all natural, low fat, or organic are healthier options for us.
Be careful with that. Anytime you go into a store, whether even if it's an organic store, and you see the labels on packaging that say that, I teach my patients to look at the nutrition labels. And I also teach my patients to shop around the edges of grocery stores to the fruit and vegetable section. In that small print, you can find often sugar and salt added, corn syrup. And these processed foods actually have hidden toxins in them that can run your blood pressure up, cause inflammation in the body, and make you a pre-diabetic and one day a diabetic.
So why eat those apple snacks instead of just the apple itself?
Exactly. And so that's why healthy options like vegetables, fruits, beans, whole grain, nuts, and seeds are exceptionally healthy for you.
Okay, but maybe not all the nuts and the seeds that are together processed in some kind of bar that has the extra sugar.
That's right. When you go down the aisles of grocery stores, beware.
Okay.
Beware.
All right. Well, myth number two. And myth number two is something we've all heard, that eating healthy is expensive.
Well, actually, some of the same food items I just talked about down the aisles can be pricey. I ask my patients to look for deals on vegetables and fruits that grocery stores often add. Also, farmers markets tend to have better prices. The Greensboro Farmers Market at Yanceyville and Summit, when it's in season, is an excellent choice. Based on your income level, you may qualify for food pantries and food banks that have actually now very healthy food options. So actually, it turns out you can eat healthy with excellent plant-based food. And red meats, minimizing that's become very expensive. Poultry, is actually come down a bit. And so I recommend these other options. And again, when you go down the aisles of these grocery stores, you will find sometimes more expensive food.
And then definitely shopping the sales, like what you said, in season certainly makes a big difference for sure. All right, myth number three, you have to do intense exercise workouts in order to see results.
With my patients, I tell them to start slow and build up, literally walking, moving your body. In patients who are a bit obese, I recommend starting out 2 to 3 times a week, 10 minutes, 15 minutes, just simple walking. Build that up to health benefits, which is 4 to 5 times a week of 30 minutes straight. I also say mowing your yard, heavy cleaning, light cycling, can also be very healthy as well, as long as it's for 30 minutes. Now, you can join a fitness center and you can do the heavy weights and light weights, but just simply walking is good. If you have arthritis or back issues, join a gym like the YMCA that has a pool, and you can do water aerobics or simply walking back and forth in the shallow end, and that provides very good benefit.
Okay. All right. All right. Myth number four, and this is kind of about walking. You need to walk those 10,000 steps that you hear about all the time a day to get any health benefit from walking.
Well, I think digital health and pedometers are great, but on the other side of the coin, there's been a recent study in a cardiology journal that said if you start out at 2,600 steps a day, that can give you some reduction in risk of mortality and cardiovascular disease. I ask my patients to get up to anywhere from 7,500 to 9,000 steps a day, and that does also increase the reduction of those risks. It's actually the volume of walking through the course of the week. If you did 9,000 or 10,000 steps 1 or 2 times a week, that would not be beneficial to you. It's the total volume in walking that you do that really confers the benefit, and doesn't have to be exactly related to step count. It can be the timing that I just mentioned, 30 minutes.
You just need to do a little bit each day or several times a week, not just 1 day or 2 days of that.
When my patients are just starting out that wellness journey, I do recommend smaller amounts. I teach them how to take their pulse and to breathe deep and slowly as they start their walking program, and then build up.
Okay, we've got about a minute left in this first segment. Tell us a little bit about Walk with the Doc program, and you're involved.
Walk with the Doc started in Greensboro a year and a half ago, led by Gabriel Nita. We meet in Country Park at Spencer Love Tennis Center. We have an initial health talk by a health professional for about 10 minutes. Then we walk slowly around Country Park. We walk with our community members. We have conversations there as we go. Dr. Philip Dixon is starting a program in Rockingham County at the Mayodan Madison Rec Center Tuesday, April 16th at 10 a.m. We walk at 10 a.m. fall and winter in Greensboro at Country Park, at 9 a.m. spring and summer, and there's a website. Type in your zip code and it tells you what a walk is closest to you. Walkwithadoc.org is a wonderful option to meet health professionals and learn and enjoy camaraderie in a walk.
All right, we're going to go to myth number 5, and this is you only really need to go to your primary care provider when you're sick or when you have a chronic condition.
Well, that myth is indeed one because your primary care doctor can be your partner on your health and wellness journey. Many conditions are completely asymptomatic. High blood pressure, pre-diabetes are good examples. Also, your primary care doctor can help you with good, important screenings. When I see patients in my clinic, I'll screen for their kidney function, their cholesterol, of course, their blood pressure, their blood sugar, but important cancer screenings can be done then as well, and identify asymptomatic conditions. Cone Health does provide a nice website where you can look for a primary care doctor, have immediately available appointments, including patients who don't have insurance. conehealth.com/appointments is a great site to go to.
Okay, and I know a lot of people have had a hard time getting a primary care provider over the last couple of years once COVID happened, and now people are going back to the doctor, so that is a good resource. All right, let's go to myth number 6. If you feel healthy and you don't have any symptoms, you don't really need those cancer screenings.
Cancer screenings, I can't emphasize enough, coming out of the pandemic, we have seen a real uptick in metastatic cancer that wasn't checked early. They're very important because early cancer can be completely asymptomatic, and the cure is much higher the earlier detect. And some have precancerous conditions which, if removed, prevent you from getting cancer. Breast cancer screening starting at age 40, cervical cancer age 25, colon cancer age 45. If there's a family history of some of these conditions, you may start earlier. We have a new one, lung cancer screening if you're over 50 with significant smoking history. That's been shown to be beneficial. Prostate cancer screening as well by your primary care doctor also is important. All of these cancer screenings are incredibly important and do save lives.
And many of them are covered by your insurance. And if they're not covered by your insurance, there are oftentimes scholarships and things of that nature that can help with that.
Yeah. Cone Health has wonderful scholarships for breast cancer screening, colon cancer screening, excellent. Cervical cancer screening is available at Cone Health. And then, like I said, for self-pay patients.
Okay.
We don't have insurance.
Myth number 7, heart disease really only affects older adults.
Well, it turns out in my clinic, I see a lot of young people, 18, 19, and 20, who are developing cholesterol, elevated blood pressure, and that, along with obesity, and we do see childhood obesity as well, can lead to early heart disease in adolescents and children, particularly if there's a genetic or pre-existing congenital component. The traditional risk factors of obesity, smoking, diabetes, hypertension increases these risks, along with the lifestyle diet we mentioned earlier and being very sedentary. Again, I have diagnosed diabetes and prediabetes in 18, 19, 20-year-olds, and my pediatric colleagues also have seen earlier conditions that all promote heart disease. It occurs earlier.
Okay. Yep, that's a scary thought there. All right, we've got 1 minute for myth number 8. It's better to wait and see if symptoms improve rather than seeking care.
That's a significant myth. If you start having chest pain that you've never experienced, it's sudden. If you have sudden unilateral weakness or severe headache, fatigue, facial weakness, trouble with speech or understanding, visual changes, that could be a stroke. The other condition, a heart attack, acute distress in breathing, acute abdominal pain. Any of these acute conditions, you should seek emergency care. More minor conditions can be handled by digital health or urgent care, such as minor sprains and strains and HENT, ear, nose, and throat conditions, upper respiratory. Those can be managed less than ER.
Okay, well, we debunked 8 myths, so thank you for your time and expertise today. If you missed any of this, it's going to be in the To Your Wellbeing section.